COVID-19 outbreaks are happening at daycares all across the country, including one daycare in Omaha that's linked to 100 cases.
Many of them tied to the UK variant, which is more deadly and more contagious. You might be wondering what that means for your children, if it's safe to keep them in school.
Well, all new this morning, our 41 Action News I-Team reporter Jessica McMaster gets some answers for you.
As people line up at mass vaccination clinics across the country, there's a group of people who still are not eligible to be vaccinated, and it's contributing to the spread of COVID-19. Headlines of outbreaks happening in daycares. Most recently, 100 cases tied to the UK variant at a daycare in Nebraska. The same variant blamed for an outbreak at a daycare in Wisconsin that sickened more than 30 people.
It's definitely concerning.
Division Director of Infectious Disease at Children's Mercy, Dr. Angela Myers, says the B117 variant from the UK is the most common strain right now in the U.S. While it's more deadly in vulnerable populations, there appears to be good news for parents.
That strain has been linked to a higher risk of death in adults, but so far it has not been linked to a higher risk of severe disease or death in children.
Dr. Natasha Berger with Pediatric Associates agrees with Dr. Myers that kids remain at low risk for severe illness.
The risk of them getting sick or MIS-C or having a significant COVID syndrome has not changed.
Still, there's a lot we don't know.
COVID-19 is now COVID-21. We don't really know what's going to happen.
Dr. Berger says kids 3 and under are less likely to transmit the virus from school into the home. That's based off what she sees in clinic.
That 4 to 5-year-old, that's where you start kind of seeing that transmission start to reverse.
Dr. Berger also suggests kids 4 and up mask up while in school. And as for the different variants, you can protect your young kids who are unable to get vaccinated by protecting yourself.
And vaccines are still effective.
Dr. Berger says she would like to see schools ramp up testing. She says schools that do this on a daily basis are able to go at full capacity and full time because they stop COVID at the door. For the I-Team, I'm Jessica McMaster, 41 Action News.